All right, hi guys. The first article that I kind of want to go over is titled The Prevalence of Childhood Sexual Abuse and Physical Trauma in an HIV Positive Sample from the Deep South. So, basically, this article aimed to examine the association between abuse rates in childhood environments in individuals who were HIV positive and undergoing treatment. The study hypothesized that prevention care strategies would be more beneficial if individuals were aware of factors that led to high-risk activity participation. So abuse in this article was defined as having an association between the related behaviors and diagnoses. Anxiety, PTSD, depression, dissociation, substance abuse, high-risk sexual behavior, medical non-adherence, poor life quality, those kinds of things. It also stated that from 2000 to 2002, in the Deep South, which the Deep South includes Alabama, Georgia, Louisiana, North Carolina, and South Carolina, that diagnosis of AIDS increased by 29%, while other southern states only increased by 9%. The real kicker is the rest of the country, the diagnosis of AIDS increased by 0.5%. So, this study interviewed 611 HIV-positive individuals from the Deep South and used a method named CHASE, and the CHASE stood for Coping with HIV and AIDS in the Southeast. Participants were asked if their parents or caregivers were often too drunk to properly care for family, if there was a presence of other mental illness, if their parents were divorced or separated, and if they had ever done time in prison. Participants were asked if their father, stepfather, or mom's boyfriend physically abused them during their childhood at all. And they were asked if they always had enough to eat growing up as well. Another question that they were proposed is if they had ever been put into another person's care, like a family member or foster care or something like that. So the results of this study found that a fourth of the participants were sexually abused before the age of 13, and 1/3 experienced sexual abuse throughout their entire lifetime. The results stated that 50% of individuals experienced sexual or severe abuse by the time of the interview. Having parents who were under the influence and thus did not properly take care of the family was also associated with more than twice the risk of childhood sexual abuse and physical abuse. Overall, it was concluded that HIV rates of reported trauma may help explain why the HIV epidemic continues to be a large statistic for this region, and that sexual and physical trauma is associated with increased risk-taking behavior and medical non-adherence. So this graph that I have here basically just shows the differences between male and female sexual abuse, and then male sexual and physical abuse and female sexual and physical abuse, and kind of how they are different, and it's kind of alarming, I guess, the differences between those. So then the next article I want to discuss is adult survivors of childhood sexual abuse and subsequent risk of HIV infection. So this article aimed to learn if having a history of sexual abuse is a risk factor for subsequent HIV infection in adulthood. So they hypothesized that individuals who were sexually abused as children would be more likely to participate in activities that increase their risk of exposure to HIV. The article indicated that prevalence studies have shown that 6 to 62% of women and 3 to 31% of men are sexually abused before they turn 18. So this study looked at 186 men and women who were 18 years and older that went to southeastern New England that were currently sexually active. These individuals were selected based off of having a high likelihood of transmitting HIV. And this is because they either have multiple sexual partners, they have a sexual abuse history, they've been infected with HIV previously, or they've had partners that were infected or who have an increased risk of getting infected with HIV. The researchers had HIV counselors and nurses and clinicians administer a lengthy behavioral questions survey to all the participants that included rate and frequency of child sexual abuse that they had experienced. The survey also included information on how often they engaged in high-risk activities, including number of years being sexually active, pregnancy experiences, the use of drugs, alcohol, contraceptives, and then their involvement in prostitution. The results indicated that 1 out of 2 women and 1 out of 5 men reported a history of rape. 28% of those women in childhood and 15% of those men in childhood. This is a quote I took from the article. It says, "Women survivors of childhood sexual abuse were 4 times more likely to report that they had worked as a prostitute during their lifetime. Male survivors of sexual abuse were 8 times more likely to work as a prostitute than that of male volunteers." And also it was found that the male volunteers who were engaging in prostitution also reported bisexual experiences, whether they were bisexual or just through the prostitution, that's what they had experienced. It was found that women who survived sexual abuse were 3 times more likely to not complete high school, and that survivors of childhood sexual abuse were slightly more likely to report a history of sexually transmitted disease or having an HIV infection. Men who reported early sexual abuse were 2 times more likely to contract HIV. In conclusion, the article stated that sexually abused people who were more likely to engage in sex work have multiple partners and abuse substances. These are all behaviors that increase individuals' likelihood of contracting HIV. Then lastly, this article is titled "The Impact of HIV on Childhood Respiratory Illness and the Differences Between Developing and Developed Countries." So this article stated that respiratory disease is a major cause of morbidity and death in the HIV-infected children. The focus of this review is to determine the pattern of respiratory illness in HIV-infected children who are living in low-income areas or developing countries. In developing countries, childhood pneumonia is often bacterial and often fatal. In these countries, malnutrition is significant and putting pneumonia at a greater risk because of that. 60% of HIV-infected kids in underdeveloping countries have died by 3 years old, according to the article. The article then kind of went into going into a deep dive between the differences of types of pneumonia. So I'm not going to name the scientific names for all of these, but I'm just going to call them by their abbreviated name. But PCP is the cause of, this is a type of pneumonia. PCP is the cause of 20 to 40% of child deaths, and its first symptom is HIV-related disease that appears around 2 to 7 months old. It is in most developing countries, the HIV status of most women during delivery was undiagnosed. And then PTB was often not found in adults and was difficult to diagnose because it presents itself in the acute stage. So sadly, really sadly, it was found to be the most commonly diagnosed during the autopsies of children, specifically African children. A quote from the article says that, unlike adults, research suggests that patterns of HIV-related pneumonia in children from sub-Saharan Africa was not markedly different than that described in HIV-infected children from developed countries in the earlier stages of the epidemic overall. And so then kind of overall, underdeveloped countries are under-resourced and don't have enough healthcare workers. There was an increased frequency of the disease due to lack of ability to diagnose and lack of preventative strategies, and also lack of later management, i.e. medications and such. So then this table, I guess, just kind of looks over the differences between sub-Saharan Africa and the U.S., the differences between the two. So just to kind of go through it, maternal HIV prevalence in Africa up to 30%, while the U.S. is under 0.5%. The knowledge of a mother's HIV status is usually unknown in Africa, whereas in the US it is known. And so that's going to kind of play a huge part into these children contracting HIV, because if the mom doesn't know when they're giving birth, then there's no preventative measures being taken. They could talk. Rates of mother-to-child transmission is 25 to 30% in Africa, while in the US it's under 5%. The estimated number of HIV-infected children is approximately 1 million, where it's around 5,000 in the US. The survival rate to 5 years is 10 to 30% in Africa, while it's over 90% in the US. And that just goes back to show like the treatment, the resources, the medications that we have in the US, the ability to diagnose that I talked about in the first presentation from a couple weeks of birth. So then this PCP that I talked about earlier is unusual in Africa, whereas the US, it's very routine. And that's just kind of the medication to go with that. Maternal death as an infant is very common in Africa, whereas in the US, it's very rare. Severe malnutrition in the first 2 to 3 years is common in sub-Saharan Africa, whereas it's unusual in the US. Available antibiotics for pneumonia kind of lists all of the ones that are available in Africa versus the ones in the US. Respiratory support available, kind of see that. And then the prevalence of smear-positive PTB is high and low. So I think this is just something important as healthcare providers, as SLPs, to understand how fortunate we are, and then also like how we could probably play a role in continuing the research, helping these low income, low SES places in America, but also the developing countries, like finding supports for them, getting the resources that we have available to us somehow to over there.